Hello and welcome everybody. I'm Anthony Gonzalez and I'm the program coordinator for the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. I want to welcome you all today for our webinar titled Institutionalizing Harm Reduction Efforts on Campus, from Policy to Evaluation. Our panelists for today will be featuring Aaron Brown, Dr. Jenny Damask, and Santee Ezell, and will be moderated by my colleague and good friend, Logan Davis. Before we get started with today's session, I do just have a couple of housekeeping slides I'd like to share with everybody. Here on the screen should look somewhat familiar as we are in the Zoom webinar format. We do welcome your questions at any time for our panelists. We do ask that you utilize the Q&A feature. We do have the chat enabled, so please feel free to introduce yourself and share reflections and resources as it relates for today's content. But again, if you have specific questions for our panelists, please utilize the Q&A feature. Additionally, if you have any issues getting your audio set up or turning on the captioning, please send me a chat and I can help you troubleshoot the issue. We encourage everybody to learn more about becoming a member of the Higher Education Center. You can learn more about the different membership tiers and the benefits that go along with them by visiting our website at hecaod.osu.edu. We also have quite a few upcoming events that I'm excited to share with everybody. We have another webinar happening next week on August 30th and is titled The Use of a Virtual Training to Address Harms from Off-Campus Parties, which will be featuring a free resource that we developed and are very excited to share with you all, and will be presented by our very own Dr. Molly Downing and Dr. Jim Lang. Our September water cooler chat will be taking place on September 12th and is titled Cultural Humility and Collegiate Recovery and will be facilitated by Dr. Allison Smith. Our September webinar taking place on September 27th is titled Supporting Students, the Connection Between Disordered Eating and AOD Recovery. We haven't released this registration yet, so please stay tuned for more details. Additionally, we have the 2023 Cannabis Symposium to look forward to, so be sure to mark your calendars as it will be taking place on December 7th. And additionally, stay tuned as we'll be releasing more information in the coming weeks. And with that, it is my great pleasure again to introduce our panelists for today. Joining us, we have Aaron Brown from San Diego State University, Dr. Jenny Damask from the University of Wisconsin-Madison, and Santee Ezell from Mississippi State University. Thank you all for joining us, and it's my pleasure turning it over to our moderator today, Logan Davis.
Thanks so much, Anthony. Thanks so much to all of you that have been here. And thank you again to our lovely panelists. Just wanted to give people a rundown of what to expect in today's session. So Anthony mentioned my name is Logan Davis with the Higher Education Center. I'm the Outreach and Engagement Manager and thrilled to be able to help everyone navigate and kind of guide this conversation today. So what's going to happen is we're going to give each of our esteemed panelists around 6 to 7 minutes to share what their efforts have looked like on campus in relation to Narcan and naloxone and training and whatnot, policy development. So each of them are going to share their brief perspective on the work that they've been doing. And then after that, we will go into some pre-recorded questions that we have from them just based on conversations we had. We do want to let you know that we welcome your questions for our panelists. And so Anthony mentioned, so submitting your questions in the Q&A feature, please do that in the Q&A feature and not the chat, because we will lose them in the chat as people do communicate with one another. So please, we want your questions as people are following along with each of our panelists and what they're sharing. And as we have follow-up questions when we get to the questions portion. So please submit your questions as we go along. And so the order of what we're going to be going in, we're going to start with Dr. Jenny Damask at the University of Wisconsin. Then we're going to have Aaron Brown from San Diego State and our home run hitter wrapping us up from Mississippi State, Santee Ezell. So Jenny, if you're ready, go ahead and kick us off.
Perfect. Thank you. And I think Anthony's going to share my slides here. Perfect. So I'm Jenny Damask. I use she, her pronouns, and I work at the University of Wisconsin, which is in Madison. We're getting closer and closer to 50,000, but we are a predominantly white institution. I work for University Health Services, which is in the Division of Student Affairs, and it's a fully integrated health services. So we have mental health services, we have medical services, And then we have our prevention services. So entirety, I believe, we're getting really close to about 200 employees altogether. Within our prevention and campus health initiatives, which is what I work in, we have about 20 employees. Four of them are PAs, program assistants, like graduate assistants. And we cover the topics of, well, we have a data and quality team, which is just a really exciting thing to have, that helps us with population health surveys, as well as internal needs for data and quality. We have a violence prevention, so working on sexual assault prevention and domestic violence prevention. My team, which is high-risk drinking prevention, and it's really strategically named. I really work on alcohol, tobacco, and other drugs, but my title is high-risk drinking prevention because it's the #1 drug used at Madison, and often we have data that shows we're at higher usage than the national average. We have a suicide prevention and mental health promotion team as well. Our approach is really a population health approach. So my team doesn't do basics and K6, some of the early intervention. So our counseling center works our mental health services works to do that. We're extremely data driven, and we really focus on those policy, system, environment work. And we have a health equity focus, which is why I think it's so important to be talking about harm reduction. So we do have a recovery program at UW-Madison that's about 3 years old. And, it's very open to anyone who just wants to learn about recovery, who's in recovery. You don't have to be completely sober. You can be working a harm reduction approach. So we try to be, really focused on health equity, which is one of the main reasons why we were really excited about the Narcan boxes that we installed on campus. So next slide. So I'm going to just talk about that in my short amount of time, but we'll have plenty of time for questions. But I think this is such a important initiative, and I'm really proud of it. So go to the next slide. Thank you. So naloxone, or the name brand is Narcan. If administered in a timely manner, it can prevent someone who's experienced an opioid overdose. So I think this life-saving medication is really, really important. We also know that even though it's blocking the effects of the opioids, an individual may need multiple doses. So that's why it's so important to also call for emergency assistance. We also knew that going in, having it publicly available, just like we have AEDs and fire extinguishers and other emergency tools at our disposal, was really important to us. And the CDC's information just showing that fentanyl was becoming the leading cause of death for 18 to 45 was even more important, particularly with the rise in counterfeit pills. We knew that fentanyl was being added to pills, powders, crystals, and often it was just fentanyl poisoning. People were thinking they were taking something else, and it was fentanyl, and it can be deadly. And so we're part of a system, the UW system. So if you want to go to the next slide, I'll give you a little background. So the UW system is about, so it's 13 schools, 13 four-year schools, and thank you. And several of them also have 2-year, I guess I could call them feeder campuses. And so we have a school in our system that we had a fentanyl poisoning death in February of 2021. And it was in a residence hall, and really no one was talking about it at that point. And then in November of 2021, there was another fentanyl poisoning death in the same residence hall at that same university. And all of a sudden it was like, what's happening? What's going on? Right. And I think it was really these two parents that found each other on a Facebook group that without them, I don't know if we would be where we are right now. And so I think advocacy is so important. When these parents talked, they kind of looked into what our university is doing, because we sent our kids away and they were in the residence halls with CAs, RAs, house fellows, whatever you call them. And no one did anything. No one said anything. What's going on here? So one of our schools, the University of Wisconsin-Oshkosh, had actually implemented naloxone or Narcan boxes at the level of like in every residence halls and several buildings on campus. So they had kind of a model that they had done just because their chief of police had noticed, you know, that the fentanyl was a serious issue. And so we had an interim president for the UW system who these parents were able to get an audience with through connections that they used. And he was all for it. He was like, I think we should make this more available. But we think each campus should decide. And and he sent out a memo saying, hey, one campus in our system already did something like this. I think you should all look into it, and you should have your legal and risk management consult about it if you're interested, but I strongly think you should be interested. So they didn't tell us we had to do it, but they told us we should consider it. So the president at the time. So we developed an internal document to start. We didn't start with a policy on it because we needed to figure out how we were going to do this. And we do think a future policy for our policy library would be a great addition because we have one on AEDs and fire extinguishers, and we really see it in the same vein as those emergency tools. So I'm going to go, if you go to the next slide. So this is a picture of the inside of one of the boxes that we installed. So the contents of the box are free. So anyone who has access to one of the buildings that they are in can open the box, and inside is an Narcan nasal spray. And so there are 2 doses in that white box. There's also a breathing barrier if rescue breaths are needed. And there also are instructions. There is, it's in the box. There's a tearaway on the front. And then inside, not pictured in this picture, unfortunately, but inside the box, there's also information on recovery resources if someone needed or wanted that. If you go to the next slide, I'll show you a picture of the outside of the box. So we mounted them on kind of a placard. And we have some steps, of course, step 1 being call 911, because we wanted to make sure people, if they're in emergency or they suspect an overdose at that moment, that they call 911. They are certainly welcome to anybody to take it from the box because we have wireless monitoring. So every time a box is open, we can replenish the supplies in that box, or we could check it to see if that's needed. So we thought that was really, really cool and something that I thought was possibly fairly unique to some of the boxes that are out there. So we worked with a organization to be a participant in their program, their box program. There are tons of programs out there, and this was just something for our state that we were able to take advantage of. And so we became a participant in their program. So we did receive the supplies for free. We signed an MOU with them. And in order to be a box site, you do have to attend a Narcan administration training, and they offer 2 over Zoom every month. And then we all in my office got trained. But we also found several student groups who really, really were interested in doing this. So we have a school of pharmacy, and their student group has been training people on how to use Narcan for a very long time. We have student groups focused on ending overdose who are trained and who want to do trainings. And so we really became a place where we could triage requests for trainings and answer frequently asked questions about, Narcan on our campus. So they have been open several times. We do get a notification. So we centralized where those notifications go. So we have an Office of Health, Environmental Health and Safety. And so they check all the AEDs and fire extinguishers monthly, and they're going to check the boxes monthly and every time one is open, and they will replenish it. So we get all of the Narcan materials from the program that we participate in, and we're actually piloting. They would normally have gotten the notification and sent that to us. So we're both getting notifications, but that way our environmental health and safety team can go out and check the boxes and fill them. And they also check them once a month just to make sure everything is going well and the sensor is working. I think I have one more slide maybe. So we have a Narcan availability map. So there's the Pulse Point app, which you can pull into your existing apps to show where AEDs are. And I'm told that you can start registering where Narcan is, and that might be able to future to pull through Pulse Point. But right now we're using a Google map. and we're able to put all of the locations of all of the naloxone. We also developed a little icon that looks like a little naloxone or Narcan spray. And we also, tell people that UW police, or UW PD also carry naloxone with them. So it's a really important thing for people to know that if they can't find it or it's an emergency, like calling 911 is a really good idea. And I know that was a really short time, and I'm really excited about future questions, but I'm going to pass it over to the next presenter.
Thanks so much, Jenny. And I love the kind of laid the foundation for us and super excited. So Aaron, we will kick it to you to keep us going.
Great. Hello, everyone. Again, my name is Aaron. I'm here from San Diego State University. I'm just going to give you all a brief overview of our programs, policy, and evaluation. So for our naloxone distribution program, we call it the Narcan Upstandard Distribution Program. When we're looking at our objectives, we want to educate our community on the risks associated with opioid use with a huge emphasis on fentanyl. Our hope is to increase access to Narcan for our students. We want to empower our students to take action in suspected overdose situations. And at the end of all this, if students need to connect with our collegiate recovery resources, we're connecting them to our collegiate recovery program. And so our Narcan program is offered in person, Zoom, and asynchronous online to meet the needs of our students. So as I mentioned, there are 3 different training platforms, and so they all cover this basic information. Again, we need people to know what naloxone is, know that it works against opioids, a huge component of bystander intervention, and how students can respond in a suspected opioid overdose. So with our training in person and on Zoom, it takes about 45 minutes to do so for the actual content, and we leave time for Q&A. For our online training, this QR code will take you to it. You can access it at a later time. That's about 20 minutes. It has a video, some assessment questions. If your university or organization is just looking for a model or looking to draw some ideas, it's easy to access. I would encourage you to check it out at some point. So with these programs, I think a really important aspect of all of this is marketing. On the left-hand side here, this is one of our first flyers that we had for our program. Really just highlighting our program and getting that message across to students. Another large component of this program is our fentanyl awareness campaign. So we talk about fentanyl, the sort of impact that it's had in San Diego County, and really, what that means for our students. And with all this, we're really hoping to get across that in the bottom left-hand corner there. So people have died from fentanyl overdose who never intended to use it. We think that's a pretty large component of that. So talking about that and wrapping that into our holistic approach. So a newer thing that we have is our Advocate at State campaign. And so we're just now launching this for our fall semester. And when we're thinking about advocating at state in the whole message of harm reduction, we want our students to be proactive, which again, this will tie everything together. So this is a newer thing that we have. Again, with the marketing, we have these programs and training available. We just need to make sure that our student population knows about them and knows that they are easy to access. So another part of this is policy, right? So what policies are supporting our harm reduction efforts, and specifically our naloxone distribution project? So my university is in California. And so California has something called a standing order. This was introduced in 2017. And so what this legal document does is it allows organizations to distribute naloxone even though they're not a prescribing entity. So we have a standing order. It's something that we applied for in 2019. Also, we have Senate Bill or SB 367. So this is a law in California that is requiring public universities to provide opioid-related education and to distribute some sort of medication, such as Narcan, to their students. So making sure that's readily available. And another way that California has been able to support all of this is basically our state health department has a grant where you can apply for Narcan and receive doses for free in an effort to support this law and being in compliance with this law. So we've had our training. We started in 2019. We've kind of worked through these different modes and been able to build onto it. But I also want to take some time to talk about our additional initiatives. So we've included opioid education in our new student orientation, starting with our freshmen. As Jenny just mentioned, there's a lot of good that you can do with opioid emergency boxes. So we just placed those in strategic locations at our San Diego campus and our Imperial Valley campus. We're also in the process of installing a vending machine, which will provide access to Narcan, fentanyl test strips, and more. The important thing of that is 24/7. We recognize the limitations of our training, kind of through staff hours or through pickup. So there's not a lot of opportunities to pick up on the weekend, but hopefully with this vending machine, we can really address that issue. And also we've been able to add Narcan related questions to different surveys that we send out. One of them is the wishes survey, which I'll talk a little bit more during the evaluation. So just a quick overview. I'm sure many of your universities may use Canvas. And so for our orientation, we created a homeroom for our incoming freshman students. We added it in there, not necessarily required, but it's there and recommended for our students. And so we were able to look into how many students used it and if it was a good place to have it. So for our opioid emergency boxes, pretty similar to the model that was just explained, we will have boxes on campus. This is the image that we had that we've created to go along on the side of our boxes. And so it has a lot of the basic instructions and kind of going back to the advocated state and having a proactive approach. We're hoping that students have either done our training or recognize some of our messaging, which is discussing these important topics. Therefore, our students are familiar with it and recognize exactly what it is. We put our training QR code on the boxes directly as well in case they haven't done the training or they walk by and they happen to be interested. So for our harm reduction vending machine, this is the mock-up of what it would look like. I think we'll have it in about 2 weeks or so. And again, this will have Narcan, fentanyl test strips. We're putting first aid kits, a variety of medication, menstrual products, condoms, Plan B. So this will have a ton of different things focused on wellness and harm reduction. So I know that I have discussed a lot of things in a short amount of time, but this timeline here should hopefully kind of paint the picture. Again, in January of 2019, we started our planning process. That summer, we received our standing order and our first installment of Narcan from that state grant. I did the very first training in November. As you all know, COVID happened in 2020. That's when we introduced the Zoom training, and to this point, we've kept it. In October of 2022, we introduced the online training. We began offering fentanyl test strips through our program, SB 367, and then some of our newer initiatives that have come in summer and fall of this year. And we've had the opportunity to train quite a few students through these 3 methods. And lastly, for evaluation, so what are we looking at? We're tracking method of participation, looking at in-person Zoom and asynchronous. So one thing I can say is at this point, a majority of our attendees are asynchronous, and that's probably due to the convenience of it. On that QR code, again, that took you to our Qualtrics form. You can see our questions. So on our end, the staff, we're looking at our students getting the questions right, which we believe will increase their knowledge and their confidence. When it comes to a lot of this marketing stuff, we've worked directly with students to get their opinions. Does this resonate? Does this go with our overall strategy and really reach our students and connect with our community? We're also taking note of opioid overdose reversals in our SCSU community when they are reported. I talked about the well-being improvement survey for higher education. So the WIShes survey, that's free for universities. Our university, San Diego State, participates in it. So what it does is it asks questions focused on well-being, mental health, sense of belonging. This is sent out to students. And so one of the things that we were able to do when we're looking at our AOD risk, we were able to add Narcan related questions. So the first time that we added those questions was April of 2023. That really established a baseline for us. And then we have the second round of questions coming in November. So that's been a really helpful way for us to look into that. And then again, this was the first time that we added info to Canvas. And so we had about 68% of students who had access to that through Canvas complete it. So we were really happy with that number.
Awesome. Thanks so much, Aaron, for kind of outlining the process. I love the timeline to see how that took place. And so now we'll wrap up the information portion with Santee and telling us about what's going on at Mississippi State.
Thank you, Logan. So I am going to share a little bit of where we have been, where we are, and where we're headed. I'm glad that Aaron kind of shared a little bit more about what California is doing, which kind of ties into where I am headed, I would say, because Mississippi actually started a little bit later. As you can see, his timeline started in 2019, and here we are. We started a year ago, which kind of ties into one of my favorite quotes by William Faulkner. To understand the world, you must first understand a place like Mississippi. And if you haven't looked at all of our statistics or how we fall under certain statistics, we are usually in the worst category or we're in the last category. And so one thing that we're trying to do is get ahead of that in the future. And so I'm really grateful that we have made this move forward with naloxone, Narcan distribution, and actually pushing this forward in the state of Mississippi. And so just a little bit about who we are and what I do. I serve as the Director of Health Promotion and Wellness. This is just a few of the things that we do, which I won't go through each one of them, but we do provide a space for students who are in recovery. We just went through some rebranding as Bulldogs in Recovery at this time, but it has been kind of the force for us as we had recovery ally dogs to lead our way, as well as our peer educators as well, to help push this work forward in what we do. And so these are our 6 pillars of our roadmap. This is how we kind of lead our efforts as a team. And so everything that is done with naloxone, Narcan distribution is through health promotion and wellness. We are actually under University Health Services, which includes our longest student health center, as well as our student counseling services. And so this is how we lead in all that we do. The bulk of our work, I have to be honest, is through partnerships and peer education. We thrive with utilizing our students, but also we thrive in strategic partnerships. And so the rest of the 4 is how our staff lead their work and how we identify those gaps in the current needs of our students on our campus and also within our communities. And so these are our partners that really led the efforts on our campus. And I'll be sharing a little bit more of how that kind of moved forward, especially on our campus during the panel discussion. But the bulk of our work came down from a state level as well. And so 2 of our partners, the Mississippi State Department of Health and the Mississippi Department of Mental Health has been our biggest champions in the great work that has been done so far on our campus. Stand Up Mississippi was created for the state of Mississippi in order to do the opioid prevention work. And as you can see around us are our partners that are on campus, and also our statewide coalition, as well as a coalition that is based in Starkville. And so I'll share a little bit more on how this kind of branched out for us and how it worked well. Mississippi Department of Mental Health, they provide, as well as the Department of Health, provide free naloxone and Narcan. So all of our distributions that we have been able to provide is through the Department of Mental Health. And so that is something we have requested on an monthly basis, I would say. And then all we do is make sure it's distributed. And so I'll share more about that next. And so just to understand Mississippi's landscape, we are definitely predominantly rural, because out of the 82 counties, most parts of it, there is some rural aspects within Mississippi. And so when I share that we are rural, I want to make sure I provide context. Most of the counties throughout the state have little to no access to certain specific things within our state. So I'll say, for instance, there are some areas who don't have access to grocery stores. There are some that don't have access to hospitals or different types of doctors. And there are some who have to drive 30 to 45 minutes in order to obtain quality health care. And so just to kind of provide context and how naloxone and Narcan is very important, because we know that if a person is in a predominantly rural area, they are at a greater risk. But we also know that they may not be able to have access to those resources at that time. And so this is just the landscape of kind of what Mississippi has been experiencing. And we're still doing the data collection, of course, through our overdose prevention efforts throughout the state and with the state collection. But this was something that was happening, but on the rise. And then, of course, we know with 2020, what happened. We all experienced COVID. And of course, many of our states experienced drug overdose deaths. In addition to that, we were able to tie in the data, and kind of what we were looking at throughout the state was who were at a greater risk. And so as you can see, African Americans, but also people under age 35, which are also your traditional college students, but also thinking about those individuals who are non-traditional also. And so our project was a little bit different in how the efforts were led on our campus. Actually, Student Association led these efforts on our campus, which I always share with students. You have a voice and you can definitely make some movement on your campus as long as you have that voice. And so our Student Association adopted 2 resolutions within the last year. We had Resolution 4 and Resolution 10. From the Resolution 4, addition to Narcan being provided with emergency kits at the front desk of each residence hall. And then Resolution 10, asking that training of Narcan administration be available to all students, residence assistants, faculty, and staff. The training was not required, but it was highly encouraged. And so with these Student Association resolutions, we were able to move forward with making sure this was provided. While we have state opioid response funding from the Department of Mental Health, we were doing the bulk of the work from a community aspect, and then also working with our collegiate recovery community on the campus to kind of push these efforts through our recovery ally dogs. With the policies, we have 2 for the state that has been very beneficial. And so one of those House bills is the Emergency Response and Overdose Prevention Act. And then the other House bill is for a Naloxone Standing Order Act. And so with our pharmacy here on campus, we provide free naloxone to them in order for them to actually distribute for us as well. In addition to that, all of our residence halls, and we have 23, will have naloxone that is readily available on the first floor. We'll also be utilizing buildings across campus that are highly trafficked, I would say, by our students. So some of our larger buildings that have information assistants and also desk attendants that are there. So they will be able to be trained. And so as I kind of shared, this has happened within the last year. And so this is just a picture of how we kicked off. We kicked off and President Mark Keenum kind of shared with us his vision and how he wanted this to go. So we hosted our first larger event for International Overdose Awareness Day last fall. And so it went really well. We were sharing about naloxone and Narcan. We weren't providing it at that time, but we were launching the trainings, and we were also training our peer educators as well as our recovery ally dogs to do this work for us, in addition to some of our students who are in recovery to kind of push these efforts for International Overdose Awareness Day. And so a lot can happen in a year. I'll have to say we have done a huge push and a huge campaign. Two of our campaigns were, and we are still doing these, are Watch Out Wednesday and Healthy State of Mind. Watch Out Wednesday was information that we were sharing about overdose prevention, kind of the trainings that we were hosting, and of course, how to be that upstander. In addition to that, our campaign overall for our campus in regards to campus health is Healthy State of Mind. And so this really kicked off during those high risk times, especially we are in the SEC, which is very fond of football. And so we knew that was going to be the best way to give out information. So we utilized our junction area, and that is where mostly everybody tailgate. And we gave out tailgating tips, but also overdose prevention tips as well. So we looked at those high times: fall break, Halloween, St. Patrick's Day, before spring break, but also midterms and finals week. In addition to that, these were just some of the overdose awareness days, recovery month, just all that we kind of partner with our health and wellness educator that oversee our AOD education. And then we were finally able to have a MOU drafted and signed. I will say, and I'll share a little bit more later, that it was tough, and there was a process with that. After we got our MOU drafted and signed, I would have to say that was the hardest part. Everything else was a breeze. And then we started doing more with naloxone training and distributions. And so as I kind of shared earlier, one of our biggest champions have been the Mississippi Department of Health. And so the Opioid and Substance Use Disorder Program, they worked with various partners, including us, to be a part of that. So they wanted us to expand access to naloxone, establish a comprehensive drug abuse surveillance system. So we have two partners that we work with: Mississippi Public Health Institute, which has a monitoring system. And then we also have a statewide coalition that is a part of that comprehensive drug abuse surveillance system. So many of our partners across the state of Mississippi are meeting on a monthly basis to kind of look at what that surveillance looked like, what are we experiencing, who may be impacted, and how could we reach those areas that may be impacted the hardest. Of course, we are looking at now going beyond just our students, faculty, and staff. We're also looking at our healthcare professionals in the area, and also working with our longest student health center, which they have been trained just so they'll know about the opioid awareness, control, and response. And then, of course, expanded access to outpatient opioid use disorder treatment. And then, of course, making sure we provide public awareness and education. And so this is my contact information. Feel free to screenshot if you have any questions, but we'll dive in deeper during the panel discussion.
Awesome. Thank you much, Santee. And I want to start with you. We had a quick question come in about the student association. Is that the equivalent of a student government association in many places?
It is, yes.
Awesome. So thank you so much, all three, for kind of sharing that context, and we'll get all of you spotlit here so everyone can see everyone. Want to start out questions with funding. How and where did funding come in for these efforts? Let's go, Aaron. Aaron, do you want to kick us off for this one?
Sure. So certainly some different avenues for funding. From the state of California, the basically state health department has a grant where universities again can receive naloxone for free. So on that timeline I mentioned, I first applied for that in 2019. I've applied for that 3 times. As we've really ramped up our training and access, and we start to, look towards the emergency boxes and the vending machine, we have looked at grants available through San Diego County and really looked at different funding and things of that nature. I can speak to funding on our fentanyl test strips, which we added last year. That is something that our university student health services pays for.
Thank you so much, Aaron. Jenny, Santee, any thoughts on funding you would like to share?
I'll just say really quickly, so we were able to find someone who was, had a program existing already. So there are folks out there who are getting Narcan direct funding or have a grant that they wrote. And that's how we were able to like basically sign on and be a participant in their program. And so they then are able to fund everything through that. And then we had to build a contingency plan if we were ever to leave the program, the other program, or the funding dried up, like what we would do. So we built that into our internal plan, so we could continue if funding was pulled at some point.
And I'll echo the same sentiments. We do receive state opioid response funding. We're one of the universities out of probably 3 or 4 total that receive that funding, but also with our distribution, with our MOU in place, it's in place for 3 years. And so with that, we will do a monthly reporting form, but then also we'll be able to access Narcan, naloxone on a monthly basis and request up to 600 units per month. And so that is how we have been able to, so we haven't had to purchase anything. More so ours is the educational piece and actually doing more of the marketing from the grant, and also making sure our peer educators and our recovery ally ambassadors are doing that work as well.
Fantastic. And I see some questions coming in the chat. If you don't mind, folks, if you could put those in the Q&A so we don't lose them. We want to make sure, because as questions are coming in the chat, I may lose those questions. So if you can please submit those in the Q&A, I would greatly appreciate that. So I want to shift gears from funding and talk a little bit about evaluation. And so how have you been able to kind of measure and share the impact of your work? But we had a question from the audience come in that comes in this area of like measuring and sharing work. But Jenny, it's directed at you directly about remote monitoring for each time a Narcan box is open. How is that information kind of used? And is there any way that you can or can't identify those people? How is that information protected? And is it ever used to follow up or offer interventions or education to folks?
Yeah, that's a great question. So we had to do a lot of publicity that if you open a box, no alarm sounds like to notify anyone, like it doesn't alarm to the police or anyone. It just sends us an email so we can replenish it. And so that replenishment may take, up to 48 hours, just because we have to be realistic about the staff time. So we don't know who opened the box most times. So like, unless we were standing right there with them, and it's just they're all over campus, that just isn't feasible. But we do have to report back a couple questions like, was it taken and was it used? And if we don't know, we don't know. We often don't know if it was used, but we know if it was taken. So we have the opportunity to insert cards into the bottom to get recovery resources and follow up social media and things like that. But yeah, we don't know who is opening the boxes. But that's part of what we want. We want people to feel like they can take it and not be like monitored. You're like, you need help. Like take it if you think you might need it, or maybe your roommate might need it, or you just want to have it in your house, or it's an emergency in this moment. So we just really want people to not have any stigma, just be able to go in and take it and not be like monitored in that regard. So that was really important to us too.
Santee, Aaron, any other thoughts just on evaluation, like and measuring impact and sharing that impact in general?
I would say for me, it's been very helpful, especially when we provide the training, but we also get feedback from faculty and staff and students across campus. And so one of the big pushes was to make sure our student leaders were trained. And so that has been helpful, especially with word of mouth evaluation. Since we've started in the fall semester, with just like various promotions and trainings and things like that, we have been able to train over 1,500, which has been phenomenal because we just started and then we're doing a big push. I think the biggest thing for us is to make sure that when we're, training and we're doing the evaluation, that we can get some follow-up feedback, which has been very helpful. I will say I definitely want to get to where Aaron is right now, especially with the training being available on Canvas. So it is accessible. Nobody has to, wait on a scheduled date or time or call us, but that is like our end goal for sure, to make sure it is a part of like orientation, because we have a Maroon U module that students go through for health promotion and wellness, but it will be great to have that training a part of the rest of ours. So.
Yeah, and so I was able to talk a little bit about evaluation on that slide put up. And so I would say we're just looking at things from different angles. We're building on what we're looking at as we continue our program and try out new things. I'd say a lot of it is trial and error. So, with anything that you're going to do, I would just make sure that just pretty much start with anything. That'll give you a baseline and you can update as you go. And then when you're adding into initiatives, you may be surprised. Like this week, when I looked up that 4,234 incoming freshmen or first year students completed the training, I thought that was awesome. I was really, really happy with that. And I think a lot of this and evaluation, we're really looking to get that sort of information out there and change behaviors and give our students the opportunity to discuss these topics, which will then in turn reduce some of the stigma and hopefully see some real change within our community.
I want to stay on this question for just a minute and thinking about sharing impact of this work. Have any of you been able to collect data on lives saved in this? And then how are you kind of sharing that info if you are able to learn that? Aaron, do you want to start?
Yeah, so kind of going back to the policy, with the state of California grant, they want you to report any sort of recorded opioid overdose reversal, with the medication through the grant. That's a little bit challenging because there's no way to exactly mandate that, but through our university in kind of looking at medical transports, looking at basically different departments that are focusing on this thing, we're looking at least 11 opioid overdose reversals with medication use from our program. Some have led to hospitalization, but no deaths within our community. But again, it is a little bit harder to track that.
Jenny or Santee, any thoughts on that question? Thank you for sharing. And 11 lives, like, wow, like that's awesome. Kudos to you guys. That's huge.
Yeah, that's phenomenal. I would say we're working with Starkville Police Department as well as Mississippi State Police Department. And so as we work together, that is something we said that we wanted to share, and we are looking for those stories. I know as the community do a lot more work. I know just with reversals, we have seen quite a few, especially over the summer. And so that has made my heart smile that people are being trained, they're responding. And I know it's been considered a harm reduction approach, but we also have to look at that from a social justice lens as well, especially for the state of Mississippi and in rural spaces and places. So that has been helpful for me. I don't have a specific number, but we have had the conversations. And I think that would be another piece of our, not only distribution, but our story of how can this look for the state of Mississippi, especially when it comes to lives saved.
And we do go through police reports. So we are monitoring, just every time there's a mention of administration. So we're just kind of just trying to collect as much data as possible. But yeah, it's hard to say that we've saved so many lives, but with 28 boxes being taken, there's an opportunity to save up to 28 lives, so it's hard to say.
Absolutely. Thank you for that perspective and knowing that we think there's impact, but we don't know exactly what that impact. I had a question come in around measurement. And so want to stay here on this real quick. Someone said they received an opioid stimulant misuse education awareness grant. What evaluation instrument have you all used for the measuring of impact? And would either of you be willing to share that? So like what measurement of impact, like kind of evaluation did you use? And is that available to be shared? Anyone want to start? Santee?
I'll share, and I don't mind sharing like what we have used, especially with that evaluation and monitoring. So we have utilized Qualtrics. We continue to utilize our QR codes that have been very helpful, but I do not mind sharing that, and I can get that over to Logan or Anthony to kind of share how we're actually evaluating, especially with the knowledge that's shared. One of the things that we ask is how comfortable are you administering naloxone? Some people do not feel comfortable, even when we walk them through the steps. So we want to see, even if that changes throughout the training, like you didn't feel comfortable coming in, but you feel a little bit more comfortable after the training has been completed. One thing that we've also done with the evaluation piece, and also just for our campus and our community, is creating a fact sheet, but also having something they can walk through. You have someone who wants to have step by step. You have other individuals who just want to do it. So I think that's how we have been able to evaluate just the change in perceptions, attitudes, their knowledge about just what we're sharing with them and how we can actually make a difference. And we're using the ICARE model as an acronym to kind of help them navigate that as well.
Yeah, so I can follow up again. We use Qualtrics, which gives us some data on kind of the education and kind of learning outcomes. I mentioned the wishes survey in my presentation. And so again, we added the opioid overdose prevention questions. We had 942 people respond to those questions, asking a variety of things like SCSU has made it simple to learn how to react to a suspected overdose. I believe overdoses are a serious risk. I know where to obtain naloxone or Narcan if I wanted it. Just things like that to really gauge. And again, talking about that baseline and before. We're newer to participate in WISHES, but it is a national survey. And I believe the ultimate goal is once we kind of collect information on our university, you're able to share it with other universities and really kind of get a nationwide perspective of attitudes and thoughts and kind of what things are working. So I can check on sharing that information or how to kind of get that out to other people.
Thanks so much. We're going to continue to go. We're going to go to an audience question here. I want to let you know we're not going to be able to get to all of the questions because we're running tight on time. We've had this question come in twice about Narcan has now been approved for over-the-counter purchase. How is that going to change, if at all, your efforts and your approach to kind of distribution on campus?
Yeah, I can answer that real quick. For us, no change, as long as there's still funding available for us to provide it for free, because over the counter would require purchase. I think it's just another thing that'll allow people to continue having this conversation and increase more access. Our program is only for students, so we find that this will be helpful for faculty and staff who are interested. It's an easy way for them to have access as well.
Yeah, no change for us. We have a contingency plan if we don't get funding anymore from the boxes to replace them. And we have 25 boxes. And we have a plan to remove stuff before expiration date and deliver to emergency folks that might use it quicker.
Same here. No change in distribution. We're hoping that they're still able to provide, but we want to make sure it's accessible. I know some people may say that it is affordable, but we want to make sure that it is accommodating for all. So we provide for faculty, staff, and students, and anyone that would like it on our campus.
Fantastic. For the next question, I want to go into a little bit about kind of roadblocks or obstacles that you've faced. This but this one is more so policy related question. And so they said, Aaron, you mentioned California has standing orders. This person says they can't get their medical director to agree to having naloxone co-located with AEDs. Who authorizes getting the naloxone out in states without standing orders? So how do you get that done if there's a standing order? Any thoughts on that?
I think I'd have to know what state they're in, because with California, we're pretty much fully supported by the policy. I will say, when you're working within your university, we have an alcohol and other drugs task force, which brings in all of our stakeholders from across campus. So even when we started in January of 2019, planning all of this, everyone who needed to be there had a seat at the table. We had honest conversations. We had tough conversations. We all got on the same page, and we're able to address these issues kind of as we moved along. But I'd be happy to connect with the person asking the question after.
I think
Awesome.
your legal and your risk management really need to talk with, maybe with or without your medical director, because it's really like identifying what is the risk of having this on campus, and is it worth the risk? And I think it's a minimal risk, and I think that's what you'll find if you do the assessment, but every campus might look at that differently. So that's my thoughts on that.
I echo those same sentiments. I think there was a pushback that we experienced was from legal and risk management. As Aaron kind of shared, if you have a task force, whether it's campus health, alcohol, tobacco, and other drugs, I would highly encourage you to make connections with them. If you don't, this is a great opportunity to start forming that task force, especially of your champions across campus. Don't leave out students. I try to share that because we utilize our peer educators, and their voice is much stronger sometimes than faculty and staff, and they could do the bulk of the work. So don't forget those student leaders who have an interest in well-being in general. They're learning about harm reduction, but I would say our greatest pushback was legal, and they were worried about the risk, but it was minimal risk. We just wanted to make sure that it was accessible on our campus.
Absolutely. We have time for one question, and it's a great wrap-up question. Had a comment or a question come in from a audience participation member, and it says, don't have a dedicated AOD or CRP program on campus. Where do you suggest that we start? And so that, I think, where do you suggest we start? Let's say they don't have any efforts going at the moment, they've received roadblocks. Where would you suggest people start, or where do they restart if they've been told no in the past? Seeing some head nods from Jenny, some smirks from Santee. Who would like to start?
I was just going to say, so there may be groups in your communities, in your state, that are giving Narcan away that you can promote, that are nearby, that you can just direct people to nearby places if that is where you need to start, because then at least you're telling people about resources that exist. And then, you know, from there, you might be able to grow. You definitely start with data always, if there's a way to show the data. I mean, leading cause of death, I mean, it's growing cause of death in our age group. So I think it's a really important issue. And so I think starting in those directions, I'm sure both of you have other thoughts.
Aaron, go ahead.
Sure. I'd say, yeah, reaching out to community orgs, there are a ton out there that could, kind of take the pressure off of you and your staff. I think I would go back to the task force. It's really helpful to have a designated space to have these sort of conversations. It's an opportunity to look at your resources and your capacity. If you don't have someone who can do in-person trainings, look at doing an online model. You feel free to look at the SCSU model, take some of those concepts, take all of the concepts. If your school color's purple, change the size of the purple. I don't know, but it's helpful to have it online. I think that could be a pretty good place to start, just access wise, and go from there.
I echo those same sentiments. I think also from where we started when I wasn't even at this institution to where we are now, it started with 2 or 3 people within the health center. And so our entire department has kind of formed a team of 20, including student workers, graduate assistants, and professional staff. And I say that because your health center and your counseling center may be those central champions to start off with, and then kind of branching out. I would highly encourage looking at community resources, but don't forget that students just don't live on campus, they live in the community, and they're connected to various organizations outside of that. Another place you can start is looking at Greek organizations as well. They should have wellness chairs. If not, they should have a philanthropy effort that are already doing the work in regards to health and well-being. So that is a start. And that can kind of form your task force. So I would highly encourage that. And last thing, don't sleep on your churches in your communities. They are pillars, and that can serve as a resource for you to start and then branch that out to your campus.
Awesome. Thank you, Santee. And what I hear you saying when you went from 2 to 20, we plant seeds. And many times with seeds, we have to watch it grow. And many times we plant things and we don't get to see them grow. And so I think we have to plant the seeds for the work and many times and water it. And sometimes the watering gets cumbersome. But so thank you so much to our panelists, Santee, Jenny, and Aaron. So much appreciate. Thank you so much for giving of your time and of yourselves. And do want to warn you, we may have a visitor here. The 5-year-old is getting home from kindergarten, day 6. So just if you see a face, apologies there, but just want to highlight some things we have coming up. We have a free webinar coming up on the 30th, talking about an online tool that we have. We have water cooler chat talking about cultural humility and recovery in September. Our free webinar, we're going to stay with recovery. So September is Recovery Month, if you weren't familiar. So be looking on our ARHE and even on your campus if things are happening for Recovery Month. And then we do have the 2023 Cannabis Symposium will be December the 7th. So thank you all so much for being with us today. It's an honor for us at the center to host these conversations and to help guide you in your work. It was an honor for me to guide this conversation. So thank you so much for being with us today, and hope you have a wonderful rest of your day, week, and the month of August. Take care, everyone.